Thank you, Mr. Speaker, and thank you so much for the supportive remarks from the member from Surrey South. The challenge is that if various communities do not achieve a target vaccination rate, it puts those people and others at risk. People who are vaccinated can still contract COVID with milder symptoms or transmit it while manifesting no symptoms at all. People who are not vaccinated have a substantially greater possibility of having severe enough symptoms that they have to be managed in hospital, perhaps in ICU. And if they survive, they may have lingering effects that impact their cardiac and respiratory functions for a prolonged period, if not permanently. Is this a risk we are willing to take for ourselves and our families? I believe everyone is looking forward to the end of COVID-19 pandemic and the restrictions that we must follow to contain it. My gratitude is boundless to all the many types of workers, frontline health, emergency personnel, others who have kept our economy going, food on our tables, and some semblance of safe social interaction happening. And to all those who have gotten the vaccine, you have strengthened the safety net that we all depend on to get beyond this pandemic. I've had the opportunity to speak with clients who are permanently dependent on mechanical ventilation, also a result of childhood polio. I've also met one of my constituents' moms who is dealing with post-polio syndrome that has had a profound effect on the latter parts of her life. She's always been energetic and active, and now she's not able to be either of those things. When she was 10, she developed the polio. The vaccine came afterwards, and the conversations around the vaccine were very similar to what we were doing now. She really wishes she had had access to the vaccine. As a healthcare provider, I have gotten the flu vaccine annually to ensure that not only I have a reduced risk of getting the flu, but also that I have a much reduced risk of transmitting it to the very vulnerable people I serve. I've also vaccinated 501 people since February in a variety of settings. Mr. Speaker, I believe we all want to get to a place where we can see each other without masks, to hug, to dance, or sing in close proximity. We all want to stop drenching our hands in sanitizer. In short, we all want the COVID pandemic to go away. We want to once again feel that our elders and our children are safe and get beyond the restrictions currently needed. The key to getting to this place of safety with each other has been offered to and accepted by over 85% of BC's population through immunization. Once again, our public health system has risen to the challenge and is providing an effective, proactive measure to manage the transmission, spread, and severity of a virulent and often deadly disease that has impacted all of us. Immunization is available to everybody at no cost. I encourage us all to get vaxxed. Thank you, Mr. Speaker.
Thank you, member.